I do a lot of oral surgery. Um, so sometimes if you take out a tooth that isn't savable and maybe there's some infection in there, we take out the tooth, and again, it is a physical thing, but yet it sounds kind of funny. We try to finesse it. In essence, we basically try to wiggle it, and if we apply pressure to a tooth, your body's response is it produces hyaluronic acid around the edge of the root, which almost like hydraulic fluid helps push it out. I tell patients, you almost think, come on, get on with it. But patience really pays off. And if you'll do that, you kind of loosen it. And then when I take it out, I can preserve the socket and keep the bone. And then if at that moment we're not putting in an implant, we'll put in a bone graft. And that sounds kind of fancy, but what we do is we take out the tooth, clean out infection, and put some bone graft material. Oftentimes it's a putty-like material, and pack it down in there and put a dressing over the top, and then I suture some crisscrosses to kind of gather the tissue and let it heal, and you really preserve the bone. Because if you don't, that bone level, you'll get a huge negative curve, and then it also collapses widthwise. So if you really want to preserve it to use for something in the future, that's really a must. In fact, it's becoming the standard of care to put in a bone graft after an extraction. It's something that we do a lot of.